David Latt says he is lucky to be alive. The 44-year-old author and legal recruiter now out of the hospital and in recovery, calling himself a grateful patient after a nearly month-long grueling battle with coronavirus. David first felt symptoms in early March, and by the 16th, he was hospitalized, documenting his harrowing ordeal on social media and urging anyone he came in contact with to try to get tested. After saying on the 18th, "I don't know that I'm getting any worse, and at this point, I'll take it," he suddenly did get worse, much worse. The two-time New York City Marathon finisher barely able to walk the 5 feet from his hospital bed to the bathroom. David tweeting, "I've had 10 days and counting with no real improvement of fever, fatigue, joint aches, chills, cough, respiratory difficulty. I have never been this sick in my entire life." David was sedated, intubated, and hooked up to a ventilator.
He's fighting for his life.
David's husband, Zach, telling us last month.
Just taking it, day by day, hour by hour. We never in a million years thought that some, worldwide pandemic would do this and, attack our family like this.
Doctors at New York's NYU Langone Medical Center put David on an experimental drug regimen to try to save his life.
We're just hoping that they end up working, but we won't know for a few days at least.
David improved and was taken off the ventilator a week later. He says his doctors still don't know if the drug therapies worked. But now David is giving back, donating his plasma to NYU as part of a study to help find an effective treatment for coronavirus. David saying videos of his 2-year-old son Harlan kept his spirits up, telling the New York Law Journal, "It's wild to think about how close I came to dying, to leaving my husband Zach to raise our 2-year-old son as a single dad. I guess my main emotion is gratitude." And David Latt joins us now along with his husband, Zach Shemtub. Gentlemen, good morning to both of you.
Good morning.
Good morning, Savannah.
Well, it's good to see both of your faces. David, you in particular, what an ordeal. Before we get into it, just how are you feeling this morning?
Good. I'm still hoarse from the time on the ventilator, and I still get winded from things like walking across a room. I have a little plastic stool in the shower because I have to sit down during even a shower. It's tough, but I'm glad to be on the road to recovery.
You are. I mean, I already followed you on Twitter. I like to think of you as a fellow legal nerd, David. And I have to say, when I first read that you had coronavirus, it seemed like you were sick but going to be okay. And the next thing I know, there's nothing from you. You're on a ventilator, obviously unable to communicate. Can you tell us what you went through, how it suddenly turned from bad to much, much worse?
So although I'm a generally healthy person, exercise a lot, don't have any major health conditions, I do have exercise-induced asthma, which I control with an inhaler. But I didn't think it was a big deal because it didn't affect my day-to-day life much. But conditions like that can make you more vulnerable to severe cases of respiratory difficulty associated with coronavirus. So when I started getting shortness of breath, it felt a little like an asthma attack. I went to the hospital, and it turned out I needed oxygen immediately. They admitted me, and then I was there for a few days, and then my condition got worse, and then I had to be put on the ventilator.
Yeah, and let me ask you, Zach, about that, because for understandable reasons, David says he doesn't remember much about being on the ventilator. You, as the person who loves him and is waiting at home, not even able to speak to him, you do remember every single moment of that. What was that period of time like when he's on the ventilator and frankly, you don't know if he'll ever be off?
It was absolutely terrifying. Everything seemed to happen so relatively quickly. And we, received a call from a nurse practitioner that he had been ventilated, and it was very clear how serious it was. And, we didn't know if he was going to make it. We didn't know what condition he was in. And it was just 5-6 days while he was on the ventilator, pure anxiety. It was difficult to reach the hospital because they were so overwhelmed. Of course, we couldn't see him. So it was a pretty terrifying ordeal.
And your parents, David, are doctors, so they knew the situation was bleak indeed. You did recover. You are back at home. I know Zach had coronavirus too, but obviously didn't have it the same experience. Your little boy's okay? How are you maneuvering now that you're back at home under one roof?
Things are good. I just have to go very, very slowly about everything. I just take my time. I've been told it's going to be weeks or months before I fully recover, but that's okay considering what the alternative is.
And we've still been social distancing from David's parents and been careful about that, even though our understanding is we're no longer contagious, but just as an extra precaution.
We are. We're recovering at their house as doctors. They have all kinds of gadgets here. You showed a photo earlier of me taking my pulse with a pulse oximeter. So
huge benefit.
You got everything you need, and I'm sure you were so happy to see that little boy again. David and Zach, it's an incredible story. I'm so grateful that you shared it with us and that you're feeling better. Keep in touch with us, okay?
Absolutely. Thank you, Savannah.
Thank you.